You're listening to The Support Report with Be Present, where we share real stories from young adults and how support changed their lives.
Hey, everybody. Thanks for tuning in to another episode of The Support Report. We are Be Present. I am your host, Justin Peters, and joined by always Kiara Riga. Kiara, how are you?
I'm not too bad. How about you, Justin?
Not too bad. I wish I was having a beverage like you were. You just showed me that you were not drinking wine or beer. And then we got on this tangent of how we've both been, well, you've been sober for way longer than I have, but I went on this like month and a half hiatus from drinking this year so far and finally broke it this weekend. But yes, kombucha is your drink of choice, I guess, huh?
Right now it is. Yeah, I found this new local kombucha shop that's entirely low waste and they have really cool flavors and cheaper than buying it in the store. So yeah, I'm having a strawberry pineapple vanilla kombucha.
Yum. I like the flavor, but I'm not really a kombucha guy in general. Gabby absolutely loves kombucha, and I'm like, I've never really gotten it.
That's fair. It's definitely an acquired taste. I will say with the chemo side effects, particularly constipation, kombucha is a best friend.
Wait, there's constipation as a side effect of cancer?
Oh, well, chemo. Yeah,
Oh,
or
chemo.
my
Yeah,
drugs, yeah.
yeah, yeah. I did not realize that. God, you teach me
It
something new on every single episode, I feel like. And speaking of things I didn't know until really being on this podcast and having conversations too, was this conversation around infertility, which I think we're going to open up in depth today. We've talked about it maybe on two or three other podcasts indirectly through just conversation that came up. But I'm excited to actually have someone on here to ask some more specific questions to. Do you want to give an introduction to the guest?
Yeah, absolutely. So I'm super excited to have this conversation around fertility. As a patient, I think it's something that it's not talked about enough. So today we have Erin Ellman on the podcast. Erin is the fertility preservation coordinator at University of Michigan Medicine. And Erin, welcome to the podcast. We're so excited to have you.
Hi, happy to be here.
So, Aaron, tell us, how does one become a fertility preservation coordinator? That seems like a pretty specific path to go down. Is there a story or a journey that got you here?
I started my career. I'm a clinical social worker, so I have a master's degree in social work and started my career in the health system. I was a social worker for the heart transplant program for about 7 years. And through that work, um, led to an opportunity to try something completely different, but still within the health system. At our institution, fertility preservation was happening. It was an option for our patients, but there wasn't anybody to really kind of walk the patient step by step through the process to help the patients connect to the care they needed as quickly as they needed it to happen. And without someone kind of managing all of that, there were patients who weren't informed about fertility preservation. There are patients who maybe didn't know the questions to ask, or providers who didn't know where to send their patients for the care that they needed. So, Dr. Molly Moravec, who's our medical director of fertility preservation, and kind of the one who has spearheaded the program at Michigan, decided that she needed someone to fill that role, and sounded like something that would be rewarding and interesting work. And I've been doing it for the last 7 years or so.
Nice. Can you kind of walk us through what that actually looks like on a day-to-day basis? I don't know if that's really the right frame of reference, but I think you probably understand where I'm going with that question.
Yeah, absolutely. So I work with all patients throughout the health system. So adults, adolescents and young adults, and pediatric patients, inpatient, outpatient, so all across the health system. And really, my primary role is to be kind of the first contact for a patient or a provider who has a patient who's potentially in need of fertility preservation services. So um, when a provider refers a patient or a patient calls, really the first thing that I want to do is chat with them about what treatment is being planned for them, what the potential fertility risk is associated with that treatment as much as we can um, outline that. It's pretty difficult to predict sometimes, but we do our best to give folks an idea of what the risk is and then talk to them about what are our options here. Um, Everyone is obviously coming to this at a very different place. Um, a 15-year-old comes to us in a different place than a 35-year-old. So we really, our goal is really to give everyone the information and then help folks meet their needs, whatever those may be. Whether that's just saying, thanks for the information, I'm going to move on to my treatment, or this is something that I want to pursue. What do I do next?
Mm. So wait, when you say the 15-year-old and the 35-year-old come from it in a different place, what do you mean by that?
Yeah, and I think, it's sometimes related to age, but really it's just with fertility. It's such a personal issue. Um, Everyone's values around fertility are different. And we've found that when we have a patient who, so I guess it's really less related to age and I would say more related to stage of life, but just as an
Sure,
example,
sure.
I'll have folks that I speak to who say, I got married last year. My partner and I have been trying to conceive, and now I got this diagnosis. This is so important to us. What do we do next? And then sometimes we'll have a patient who maybe is one of our younger patients who has not even thought about future family building and says, you know what, this is too much. This isn't something I really want to consider right now. My focus is just moving on to my treatment. And, it's really, I think, one of the most important things that I feel like one of the biggest responsibilities I feel like I have is to really just meet folks where they are. And again, I feel like my role is to give folks the information and really let everyone make their own decisions and help wherever we can. But certainly, everyone just has a different way of thinking about it and different things that are important to them.
And this is really music to my ears. When I first started treatment and we thought I was early stage, I can't tell you how many people like, I have known for years that I don't want kids, and I can't tell you how many people I met with at oncology who were like, "Just freeze your eggs, just freeze your eggs," and, like, that's a very invasive procedure and things like that, and so I think your patients are so, so, so lucky to have someone in your role who's there to just support them, but I'm curious how you handle this, like, let's say with a younger patient who's mother wants them to have kids, but maybe they don't. Like, how, as a supporter, do you go about really doing the best thing to support your person while also, knowing that they're going through a crazy amount of trauma and wanting to be the level-headed one and think through things that they might not be able to? It's a really tough balance. So I'm curious what you recommend around that.
Yes, you're absolutely right. And that's something that's so common. And I think it is a really difficult balance because on one hand, we want to respect the patient's autonomy, and I would say that that's probably the primary goal. But particularly with, you know, a, a teenager or a younger patient, their parent's job is to help them kind of think in the future when developmentally they may not be able to do that. Um, so there's a couple of practical things that I try to do to help support the patient. And one of those things is sometimes asking parents to step out of the room.
Mm.
Just kind of something as simple as giving the patient the opportunity to talk without their parents, because I think that that sometimes can give us an idea, is this something that they're interested in learning about, but they're not comfortable talking about openly with their parents. I think again, there's just so much fertility is so personal. It also leads into a lot of other really personal topics like sexuality. And there, these are things that kids just may not be comfortable talking about with their parents. Or, quite simply, they may just be not interested. So by getting parents out of the room, we can kind of get to more what the patient's concerns are, what's important to them. And fundamentally, it really is something that we need, even from a young person, we need their buy-in to. It's just not something that a parent can really make a decision on behalf of their child. So that does sometimes lead to some really difficult conversations, but I think we do our best to support both sides. And I think that sometimes it's also, again, having a separate conversation with the parent and assuring them that kind of honoring what their child is telling them is the best way they can support them in this moment. We don't know what's going to happen in the future. So while there is certainly, it's certainly important for parents to kind of help their children see the bigger picture. Really all we have to work with is the kid who's in front of us. And if this is really not something that they're interested in, we have to respect that.
I love that. So what if the kid sitting in front of you is bought in, but
Mhm,
obviously, I think we all know that fertility preservation comes with a pretty significant price tag.
mhm.
I know that that varies by state and different legislatures and what have you, but I'm curious how you handle that, if there's any resources you know of, because that's one thing that I hear constantly of like, I really wanted to freeze my eggs, I just don't have the money.
Yes, that is one of the biggest barriers that folks face when they are interested in fertility preservation. But finances often can be an issue. So in our state, the state of Michigan, there is not an insurance mandate to cover fertility preservation. So it's pretty rare that we have folks who have insurance coverage. Obviously, that's the best case scenario. But in the absence of that, there are some resources that we can offer. We frequently have our patients utilize assistance through the Livestrong Fertility Program. So that's one of our biggest resources. Um, there's also some other resources that can help with medications. There is a grant program that we have used called Team Maggie for a Cure that is a smaller organization than the Livestrong Fertility Program, but provides grants to individuals going through fertility preservation procedures. Um, and then internally in the health system, there's some things that they can do when procedures aren't covered by insurance. So that is one of my roles to help folks kind of navigate the financial piece. And it's also one of the most heartbreaking conversations to have because sometimes cost just is prohibitive and it is the reason that people can't proceed. And that's never what we want to happen, but it does sometimes happen, unfortunately.
It's such a hard thing. I mean, I'm in
Mhm,
California where there is an insurance mandate, but even then, you're
mhm.
paying tons and tons and tons of money. And that's just, it's really, really hard to see, you know? So, I think it's fantastic that you have, at, in Michigan, at University of Michigan, you are there for these patients. But I think the majority of people treated for illnesses that could cause infertility or treatments that could cause infertility don't have access to these resources. And I've heard so many misconceptions about fertility, fertility preservation, all kinds of things like that. So, I am curious, what sorts of misconceptions do you hear on a day-to-day basis? What sorts of things do you wish you could clear up, whether it be from patients, from doctors, from anybody?
Yeah, I think one of the things that I don't know that everyone is aware of is that the if we can get information to folks as far in advance of their treatment starting as possible, we're going to have the most options to offer and the most time to coordinate those options, the most time to think about the financial piece of things. I think sometimes, even in our health system, where we have a pretty established program and we've really made an effort to connect with our providers and make sure they're aware of these services, sometimes just because of everything going on, sometimes because of the way a disease process works, there's just not much time for folks to get this information and make the decision. So I think just knowing that the more time we have, it's never too early to bring this up because the more time we have, the more options we can provide. And I think another misconception is that, particularly for individuals who are interested in egg freezing, um, I think one misconception is that it's going to take months to get someone through the process, that it's going to delay their treatment for so long that it will become dangerous. And with the way that they're able to do protocols for stimulating the ovaries for egg preservation, we can typically get someone through the process within 2 to 3 weeks. Um, there are certainly times when 2 to 3 weeks is too long, but a lot of times when folks know we don't have to wait for a certain point in the menstrual cycle, this isn't going to take 2 months to even get you started. Um, they're surprised to know how quickly it can happen. So I think sometimes if folks knew that, they may be more likely to look into it more.
That was one of the things that shocked me the most too. I don't know why I thought it was like a 6-month process to freeze
Yeah.
your eggs. And they were like, yeah, it's a couple of weeks. Like you're not getting on treatment in a couple weeks anyway. So yeah, that was really, really interesting. I'm curious from the physician standpoint, do you ever have any like pushback from physicians? I've heard anecdotally in the cancer community, just so many people whose doctors never told them that their treatment could lead to infertility or weren't aware or didn't know where to send them. And so I'm curious from the physician standpoint if you ever see any kind of pushback there or what that generally looks like from your perspective.
Yeah, I think that we're very lucky at our institution that we have a lot of support from our physician partners. And again, I think, one of the things that I think has helped get the physicians on board is that we've created a pathway for these patients that doesn't interfere with their cancer care, that's easy, and that they don't have to think about. They can just send me a page, send me an email, and we take the fertility piece off of their plate, and just kind of take care of things. So um, I think that in the absence of such a coordinated effort, there would be more pushback from the physicians because certainly the priority is getting this treatment started. But what we've learned is that when folks aren't informed about fertility preservation, even if they didn't want to pursue anything, even if it wasn't something that they would ultimately have ended up doing, um, the ability to cope with that down the line um, is much more difficult when you weren't informed about it. So we found that just having the information and being able to make that decision does benefit patients, down the line. So um, being able to offer those services so easily, I think has really helped physicians get on board. And I think it's really just been approaching, physicians collaboratively, and explaining what we can do, how we can do it, and again, proving it. Being able to get these folks through quickly has helped with those relationships for sure.
Aaron, as we're like wrapping up the conversation here too, I do want to shift it over to the supporter perspective, and as someone that's had hundreds, maybe even thousands of these conversations across the last 7 years as well, I'd love it if you could recommend or suggest any best practices is not the right word. That sounds so corporate, but any best practices in having these conversations, especially as myself as a friend or supporter of somebody going through cancer that maybe hasn't necessarily thought through this yet.
Yeah, I think going back to where we started the conversation, with being intentional about what the person really wants, really just kind of taking their lead, and going back to what Kiara said, I mean, everybody is different, and this is something that we really don't know how someone feels about it until we ask. Um, so I think, again, just meeting folks where they are. Um, and I think just kind of generally how I approach support in my professional life and in my personal life, um, being present and listening more than talking. I think that's sometimes hard to do. I think sometimes when these conversations are always going to be somewhat uncomfortable because we don't want to offend someone. We want to be supportive. It's always coming from a good place, but sometimes can feel uncomfortable. And I think when we feel uncomfortable, sometimes we feel like we have to fill up space and fill up silence. And I
Yeah.
think just being present and allowing folks to let you know what they need is you can't go wrong.
So wait, how do you usually introduce the conversation? Does the physician introduce you and kind of what you do? And then what is some of your first questions, I guess, whenever you're starting these conversations?
Yeah, so it's very variable. But usually I try to start by asking the patient kind of what their understanding is about their diagnosis
Oh,
and
smart.
what they've heard from their physician, if anything, about fertility. So that gives me an idea of where we're starting from. Um, I've had experiences. I think it's a dynamic process. So I'm always kind of observing and listening as we go because sometimes I'll start kind of on the spiel of information and I can see the tears starting to come in someone's eyes, or I can see someone looking away, or there's the body language and the cues to tell you, I need to stop and check in here and see if this person is ready to hear this, if we need to stop, if they have questions. Um, I think sometimes when this is your job and you've got a list of patients that you need to see and you're trying to get through your work, it can be easy to just check things off a list. But again, just to be intentional and to be present with that person and attend to what they're kind of giving back to you in that conversation.
Mm. Yeah, that was a
I
really great
think
answer.
Yeah, I totally agree. And I think it's even like I've had experiences in my own life where most of my friends knew that I didn't want to have kids, but I still, the infertility of all of this, like hits me harder than I think I ever expected it to. Right. And so I remember once I was at my friend's house and they were all talking about kind of fertility and planning. Everyone's kind of at the age where they're all getting pregnant. And so they were talking about kind of planning for that and ovulation and things like that, and I had to just get up and excuse myself to the bathroom, right? And so I think even just like, okay, someone doesn't wanna have kids, they probably don't care that they're infertile. That's not necessarily the case too.
Mm.
So, like, kind of listening to every side of it, I think, and the verbal and nonverbal cues, I think everything Erin said is so spot on, and, yeah.
So, Aaron, how about you wrap us up here? Before we ask our final question, where can people learn more about you, connect with you, anything that you would like to plug in particular?
Really, I mean, even though we are based in Michigan, through the University of Michigan, I have a email address and a direct phone line where folks can always ask questions, and um, we could always kind of help point in the right direction. There is also a national phone number that folks can call to be connected to a fertility navigator through the Fertility Consortium, who probably has a better um, handle on kind of more nationwide resources. Um, and
Wait, Aaron, can I pause you there? So, how does
yeah,
one find that number? What can they Google
yeah,
something in particular?
yeah. So the phone number is 312-503-3378. Um, and that is Fertility Consortium's patient navigator for fertility preservation. Um, Again, throughout the country, throughout health systems across the country, there's a growing number of folks in this role. So even, I think for folks who are just getting started with treatment or who know someone who's just getting started with treatment, just asking the question because it isn't always going to come naturally maybe to your provider, but there may be resources even within your own health system to take advantage of.
Mm.
That's amazing. I didn't know that existed. Thank you.
Yeah, yeah, we've got a growing number. We have a listserv with folks who do this work, and it's growing all the time, more and more. So there may even be resources locally that folks can take advantage of.
Love that. Well, to close out, Erin, I think we touched on this a little bit, but we always ask our guests as the last question, what does great support look like to you?
Yeah. Again, in addition to those things that I spoke about, I really think that I just can't stress enough this idea that everyone is different. Everyone's going to need different things. I think one thing I'd add to what I spoke about before is that these needs can also change, right? So just because you may have your friend, your partner, your coworker who's freshly diagnosed and they don't want to talk about it, that may change. That may evolve as they go through the process. So I think being mindful that being mindful of that evolution in terms of what kind of support someone needs can be helpful too. That not only is it really individual, but also it can change over time. And so to keep checking in and kind of keep being present.
Mm. Love that. Well, Erin, thanks for joining us on the podcast. We had such a
Yeah,
pleasure.
thanks for
You
having
were the
me.
right person to have this deep dive with. Like I said, I know
Oh,
we
good.
danced around this conversation quite a while, and Kiara and I have been looking for the right person, and it was totally you. So thanks again for joining us.
Of course, thanks for having me.